Hello there, and a huge congratulations on hitting week 31 of your pregnancy. We are about to dive into the absolutely incredible world of your baby's development, check in on all the amazing changes happening in your own body, and start looking at some of the big, exciting decisions just around the corner. Okay, so at 31 weeks, things are really kicking into high gear. I mean, your baby is developing at a truly mind-blowing rate, and your body's getting into those final prep stages. So let's take a closer look at what's happening right this very moment. First up, let's pull back the curtain for a little sneak peek at what your baby is up to in there. Trust me, their world is getting more complex and honestly more fascinating every single day. Can you believe it? Your baby is already a professional yawner, practicing for their big debut? And while scientists are still trying to figure out exactly why they yawn in there, catching it on an ultrasound is just, well, it's an amazing preview of the little person you're so close to meeting. And oh, yawning is just the beginning. If we could get a 3D peek inside right now, you'd see this whole range of facial expressions. They're grimacing, maybe a little smile, sleeping peacefully. It's like a full-on dress rehearsal for all the ways they're going to communicate with you once they're finally in your arms. Now, this is huge. It's a sign of a major leap in their brain development. Your baby isn't just randomly active anymore. Nope. They've established clear cycles of being awake and being asleep, a rhythm that just gets more and more defined as they grow. And what's really fascinating is how they're spending their time. Check this out. Almost half of their day is spent in deep, quiet sleep. And a big chunk is also in REM sleep, That's when we dream, and it's absolutely crucial for their brain to develop. And here's a shocker. Less than 10% of their time is spent in what we'd call a truly active and awake state. All right, let's shift focus over to you, because your body is making its own incredible preparations for what's coming. It really is like a symphony of changes, all working towards one beautiful goal. So you're probably noticing several changes in your breasts as they gear up for feeding. They'll likely feel fuller, the areolas might get a little darker, and you might even feel some lumps, which is often just the production of colostrum. That's your baby's very first milk. And this happens whether you plan to breastfeed or not. It's just your body's amazing, automatic way of getting ready. Okay, let's talk about something a little more on the medical side, but it's really important. It's something your doctor will be keeping a close eye on around this time, the rhesus factor, or Rh factor. Now, I know it sounds kind of complicated, but the whole process is actually super straightforward. If your blood is Rh negative, and there's a chance your baby's is Rh positive, your immune system could react. So to prevent that, you're given a simple, totally safe injection that just protects both of you from any potential issues. Easy as that. So with your body and your baby both getting ready for the main event, now is the perfect time to start thinking about your preferences for the big day itself. There's so much talk and sometimes a lot of pressure around the idea of a natural birth, but it is so important to remember that every single birth story is unique and everyone is valid. Honestly, keeping an open mind is one of the most powerful and kindest things you can do for yourself right now. I love this slide because it perfectly captures two different perspectives that point to the exact same conclusion. Whether it's a doctor advising flexibility or a mom sharing her hard-won wisdom, the ultimate goal is identical: a healthy baby and a healthy mom. And really, that is the only definition of success that truly matters. And remember, you also have choices about where you'll give birth. From the full medical support of a hospital to the cozy, home-like vibe of a birthing center, or even the familiar comfort of your own home. Each option offers a totally different environment for this amazing experience. All right, let's hit the fast forward button just a little bit and think about some of the first decisions you'll be making for your newborn right after they arrive. Thinking about this stuff now can make those first few hours and days feel a whole lot smoother. One of the very first decisions, and one you kind of have to arrange beforehand, is about something you've probably heard about: cord blood. So here's the deal with cord blood. The blood that's left in the umbilical cord is packed with these incredibly powerful stem cells. They're like the body's master cells, and they have the potential to treat dozens of diseases. The best part? The collection process is completely painless and safe for your baby. It's definitely something to chat with your doctor about if you want to learn more. Okay, another big one to start thinking about now is the sleeping situation for those first few months. It's truly one of the biggest questions every new parent wrestles with. This table lays out the current safety guidelines really clearly. The American Academy of Pediatrics strongly recommends having your baby sleep in your room, but in their own separate space, like a crib or a bassinet, for at least the first 6 months. This makes a huge difference in reducing the safety risks that can come with co-sleeping in the same bed.
And finally, a special shout out for those of you expecting twins, triplets, or more. Your journey has some unique considerations, and it's great to be aware of them.
Yeah, with more than one baby on board, there are a whole lot of ways they can get settled for birth. Their exact positioning, which an ultrasound will show you, is a really key factor that helps you and your doctor come up with the safest delivery plan, whether that ends up being a vaginal birth or a cesarean. This table gives us a great side-by-side look. As you can see, twin pregnancies are usually a few weeks shorter, the babies often have a lower birth weight, and there's a much higher chance they might arrive a little bit early. So, as we've talked about all these incredible developments, all your body's preparations, and all the different plans you can make, it really brings us back to one central grounding question, doesn't it? In the end, this is what it's all about. This is the thing to hold on to through all the twists and turns. A successful birth is one that ends with a healthy baby in your arms and a healthy you. Your journey is yours and yours alone, and that is always, always the ultimate goal. Congratulations again and all the very best in the exciting weeks to come.